Good evening, everyone. I'm Dr. Sarah Mustafa from DentistChannel.Online. Welcome to today's webinar about Communicate to Win, how to bond with your dental patients. While we are waiting for the participants to join the session, I will introduce you to our company. DentistChannel.Online is a digital dental media company. It is your marketing solution for dental events, product launches, workshops, and courses. We also provide a collection of scientific articles and blogs about different topics in dentistry. We work hard to be your first hand information on the technological advancements in the dental field. Now it's time to start the session about Communicate to Win, how to bond with your dental patients. If you have any question about this topic, please feel free to ask it in the question and answer box, and we will answer each and every question at the end of the session. I will start by introducing today's session speaker, Joan Acosta. Joan Acosta is a best-selling author, speaker, and hypnotherapist who, since 2012, has worked with teams of caring dental professionals to help them deliver an exceptional patient experience. Joan has worked as a dental practice manager, patient coordinator, and consultant. He offers in-person and virtual training programs on patient communications and influence. Welcome, Joan Acosta. It's our pleasure to have you with us.
Thank you, Dr. Sarah, and thank you, Dentist Channel Online, for having me. I truly appreciate the opportunity to speak about a topic that is very dear to me. I'll tell you a little bit about myself, but not to get too boring. We're going to keep that part short, and then I'm going to give you some skills that you can actually go home with and practice, practice with your patients, because that's what this is all about. Today's workshop is about communications. And so we're going to talk about language mostly, and we're going to talk about language in a way that is going to help us do a couple of things with our patients, which is build that relationship and then influence them to do what is in their best interests, right? So before we get going, I'm not sure who's online. Yeah, we do have a few participants online right now. So I'd like to sort of survey the audience a little bit and see what you guys are thinking, make sure that everybody is on the same page here to learn the same stuff. So let me tell you a couple of things and see if I can prompt some answers from you as well. So let's talk about some frustrations that might come up as a result of having negative communication with your patients. So if you think about what happens to your patients, what are some things that frustrate you when it comes to communication? And I'll get you started. One of the things that I think of is the idea that patients feeling pressured to buy something that they maybe don't want or need, so that is frustrating, obviously, to the practitioner, to yourselves, and that is frustrating to the patient. The other really important thing that happens with bad communication is that there is low case acceptance, right? Meaning that there are a bunch of patients that come in for an exam to get checked out by you, and then they leave. They don't actually end up getting the treatment that you recommend because somehow they were not either expecting that, or they didn't like something about the way that the relationship was being built, or something didn't go quite right. Yeah. So let's think about other frustrations that you can have when it comes to communication, and that your patients could have with communication as well, with you and your team. How about the idea that patients don't listen? Does that happen to you? If that happens to you, if some of these things resonate with you, go ahead and type yes on the chat, just to make sure that we're having a two-way conversation, because talking to a camera is a little bit boring. I like to make sure that there's other people there listening. So thank you for that. Yeah. So do patients don't seem to listen, and you wish that they would listen because you know that you're doing the best thing that you can for them, right? You are doing something that is important for them and for their health and for their families even, and for their success, for all sorts of things in their life. And when they don't seem to listen, that's really frustrating, right? How about this? How about having team communication issues? Like you say something and it doesn't seem to get through to the right place in their mind, Just a second. Excuse me, I have something in my throat. All right. So team communication issues are other frustrations. If you have those, type yes in the chat. How about not getting enough referrals? And maybe you think that this is a communication issue, or maybe not, but I tell you that not getting enough referrals from your patients can definitely be a communication issue. And I'm going to, through the presentation today, which is going to be about 45, 50 minutes long, something like that, we are going to sort of work through all of these. And I'm going to give you some tools to improve your communication in many different ways. So how about the patients not showing up? Does anybody have that problem? Do you schedule patients and then they don't show up? If you have patients that don't show up to your practice, you can type yes in the chat. And again, that is also a very common issue with dentistry. You know, patients that in the moment, they're like, oh, my tooth hurts, I really need an appointment. And they call and make the appointment and they say, yeah, we'll see you Thursday at 3 p.m. or whatever. And then Wednesday afternoon comes around and they get the phone call and they let it go to their message because they're scared to pick it up, but they get the phone call, hey, we're making sure that you're going to be here tomorrow at 3 p.m. Click, right? Just a confirmation call. And then they are scared of it. And then the next day comes around and they're like, oh, my tooth doesn't hurt anymore that much. I don't know, maybe I'll go another week. And they just put off the appointment because they're either scared or, you know, for some reason, the relationship between you and your patient is not working properly. And then they end up going to other places, right? So is that frustrating when your patients come to you for an exam and then all of a sudden you no longer have them, right? They're gone. So that's really frustrating. That was one of the things that actually prompted me to start doing what I do, which is teach and train dental professionals in all roles of the practice on how to communicate with their patients, how to make them happier with less chemicals, how to make them more comfortable without having to use some weird techniques, because this is really all about just the way that you explain things, the way that you communicate with them and build a relationship. So if those are some frustrations that you have, let's talk about what are some things that you could possibly want that would actually sort of counteract those or like sort of cut those frustrations away. If you think about this, patients knowing that you care, right? Having the feeling that you care would be an important thing, because if you think about it, if a patient is feeling like, well, this person cares about me as a person, they care about my health, then whatever you communicate to them, whatever you recommend to them is possibly going to be received in a better way, right? Is going to be understood better if the patient feels and understands that you care. So that would be something that you would want out of this, right? I'm telling you this because this is all the stuff that we're going to get out of this short presentation, or, let me back up. It's not all the stuff we're going to get from this presentation. I'm going to give you tools to work on all of these things easily, and you're going to be able to see results with them quickly. However, you have to understand that what I'm talking about, the language of ethical influence, how I like to talk about it, is a long process. It's something that is a language, and as any language, you don't just learn it like that. You have to have some practice. You have to have a little bit of technique. You have to understand the grammar. You have to understand a lot of things about the language in order to be able to speak it fluently. So we're going to get started today. I'm going to give you a good primer on it, and then later on, at the end of the program, I'll give you my contact information, and if you'd like to work together in some other way, of course, we can do that. Yeah. So patients saying yes would be something that would be important to you, right? In your practice. I mean, if case acceptance is something that's important to you and your practice, type yes in the chat, because that's what it works. That's how it works, right? If you have 10 patients that show up and only 2 of them or 3 of them get the treatment that you recommend, that means there's 7 or 8 patients or so that are running away, going to a different dentist. So the patient saying yes is something that would be extremely important to any dental practice, really. And the patient adhering to your instructions, right? If you have patients that are not brushing, not flossing, or you tell them, hey, you have done an extraction and you say, hey, don't smoke for 7 days because we want to make sure that the area stays clean, right? We don't want any issues, any infections. And they don't do it, and they come back to you in 3 days and go, oh, I have this pain. and then you go in there and you find out that you have dry socket because the patient has been smoking over the last few days, right? It's like, well, come on, I told you not to smoke, right? So that is something that we always want, is the patients to actually adhere to our instructions, right? And everybody working as a team, being able to communicate with your hygienist, communicate with your assistant, with your front office manager, with your patient coordinator, anybody that you have in your office, or if you are a solo practitioner with just an assistant or a receptionist, in any case, you want to have proper communication with those people, right? To be able to clean the things that you say up. If you say something that's not coming out right and it's received that way, it's whose responsibility to clean it up? It's yours, right? If you said something and it didn't come out right and the person misunderstood you, quote unquote misunderstood you, then it is your responsibility again to clean that up and fix it. So when communication is right, patients basically refer themselves because they feel like you have made a connection, and the referral becomes really easy because there are many bad dentists. There's just a lot of them. There's just a lot of dentists, period. And many of them are not very good, especially at communicating. They might be great clinicians, but they were never taught in school how much you have to convince your patients to actually do what's in their best interest, right? So when a patient finds a dental practitioner, a dentist who is very good at communicating and building a relationship and making them understand that they care, then the patient feels, right, when they talk to the next person, to their friend, and they go, oh my gosh, this dentist was so different than all the other dentists because he or she took the time to build the relationship with me, and it was actually, you know, really good. Like, I feel like they care. I understand them. They understand me. They know me. Like, they know my kids. They know my family, right? They have taken their time to build a little bit of rapport. Yeah. So, you know, there's a lot of why learning better communication in order to improve with your patients. And, you know, there's the frustrations, there's the ones that you can have, and then there's also some mistakes that maybe you realize that you are having, you know, in your, whether it's you personally or with your team, or something that your patients are saying that isn't quite right. You know, like one mistake that I have noticed many dentists have, and dental professionals, because this is not just for dentists, but hygienists, assistants, anybody that works with dental patients can really benefit from these skills. And in fact, if you work with them in your team, then everybody will work a lot better and it will be a lot easier. So one of the biggest mistakes that I see teams doing basically is not taking enough time to build rapport with the patient. And in a little bit, I'm going to give you an example of actually a dental visit that I had where the dentist didn't do a very good job of building rapport. And I was, you know, I felt a little bit bad. I felt a little bit off about the way that the communication was going. You know, I didn't really like it, you know. So basically, lack of skills is a mistake by anybody's part, because if you know that your communication skills are not up there where they want to be, and that your patients are really like getting glued to you, and that they're enjoying their visit and all those things, then it would be up to you, if you want to be that top practitioner, to build the skills that are going to do that, you know, which is, by the way, pat yourself in the back for being here, for, you know, taking this free course, because it's a few minutes of your time that are going to turn out to be very important when it comes to communicating with your patients and making things easy for yourself. Okay, so thank you, by the way, for being here. I really appreciate that. All right, so let me show you what I think is important here. I have created what I like to think of as the patient communication triangle here. And the triangle is going to have a few things here. One of them is going to be language, since we are mostly going to be talking about language, although language is not necessarily all spoken, right? Some of the language can also be, some of the language is actually done, by body language, you know, just your expression, the way that you interact and the way that you move, and that sort of stuff. So getting the right balance of professional talk and a little bit of personal touch is the difficult part. Absolutely. And you know what? When we get to the rapport section, I'm going to give you a great story that speaks specifically to that. So let me go back to the triangle. In the triangle, we have language as the base. Then we have rapport. And then we have influence. So this is just my triangle. So this is just a model that I created for this particular presentation in order to explain what I want to explain. So language being sort of the base of it all. And I'm definitely going to give you some tools and some tricks that you can take to your office right away. So if you have patients tomorrow, you can go to your office. Well, tomorrow's Saturday, I guess. Different time zones, but I don't know what time it is where you are. But next time you see your patients, you can actually use some of the tools and tricks that I'm going to give you. But I am going to give you those at the end, because first we want to build the rest of the presentation. So just kind of bear with me a little bit. The idea that we're going to use language to do these two things is build rapport and create influence with our patients, because those are the things that we need. If you think about it, in order to influence anybody, we have to have rapport with them, unless we have a gun, or something like that, and then we are able to influence the person in any case. Does that make sense? So that would be the difference. In the dental chair, you don't want to be that forceful. You don't want your patient to feel like you have a gun. You want your patient to feel like you have built a relationship. Does that make sense? Yeah. So we're talking about rapport, and the most important thing is the intent. So Deepu, let me tell you about this appointment that I had at my dentist. And I went to a new dentist. I work with hundreds of dentists, this way, virtually. And I hadn't been to a dentist for a while. And the last time I went, I went in and I was getting my exam done, and the doctor was very quiet. He didn't really say much, but what he did say is, so what do you do? And I told him, I said, well, I'm a television host. I host programs for dentists. I host coaching programs for sports teams. I kind of gave him a few things, and I felt, as a patient, I'll tell you from this side of the story, that as a patient, I felt like he was only asking me that question so that he could then dig in the wound, so to speak, and say, well, why haven't you been here in all this time? You obviously need this. That's something that I already knew, right? I already knew that I had to be to the dentist, and I hadn't been in a long time, and that it was important for me to go. So I didn't need the guilt coming by him, and so it felt to me like the only reason he asked what I was doing, what I did with my life, was so he could say, well, you should have been to the dentist sooner, and apply a little bit of guilt. And I felt, kind of like your patients feel, I think sometimes, and I don't think he did it I don't think it was necessarily in a bad way, like he planned it that way. I think that was just like, wow, this is what you do, and you haven't taken such good care of your teeth. And I'm like, well, but it was the intent, what felt like the intent of that conversation that didn't really allow for building of good rapport. Does that make sense? When we are building rapport, think about, yeah, you should have come 6 months earlier. Yeah, totally. Creating that guilt is not necessary, because the patient already knows that. So if you are the dentist that currently says, hey, you should have been here long ago, you can preface that it's okay, because it is okay to tell the patient, hey, you should have been here. They need to learn that. We patients need to learn that as well. But if it had been prefaced a little bit by, well, with the kind of stuff you do, and I mean, obviously, that a long time ago would have been a great time to be here, but it's great that you're here now, and then change, like redirect the conversation into something that is going to be a little bit more positive. I like to think of when patients show up to the practice as you basically have a wall right in front that you're going to have to deal with, that you're going to have to break in order to actually get through to them. because it's a bit of an adversarial relationship to start with. If you think about it, sometimes the patient just gets to the dentist and sits in the chair and they're already feeling like they're going to sell me something I don't need. And that's how they feel. And if that's how they feel, then that's a wall. You have to come in as a practitioner, let them know, hey, Mr. Patient, I'm not just going to sell you something that you don't need. We're going to look at this together, and I'm going to share with you some information that might be important about your oral health. It's their health, and you have to let them understand that that's your position. If you understand that would be a much stronger position to be in, then you're in good shape. But having the right intent would mean wanting to create the right, wanting to create the right relationship, to build a relationship that doesn't have pressure attached to it. If the patient always feels like they have to be negotiating with you about their health, then that's a relationship that's not good. The patient should feel like you and them are a team, and that you can actually work together to make decisions about their health, and that you are a counselor, that you are somebody that is there to explain some options because they haven't gone through all the schooling that you have. I mean, that's natural. So one of the other things that's important in building rapport that I find is how you use your body. This particular dentist would always, until we had a conversation, I was able to tell him these things, because I think that's proper, for you to build a relationship with your patient, when your patients can be like, hey, you know what? Can you scoot a little bit this way so I can see you? Because this particular doctor, he would, for example, I'm sitting here in the chair, and he would stand right on my shoulder, a little bit behind, and I'm already here. I can't turn around. I have, things in my mouth, and he's trying to have a conversation. And then he's basically telling me what I need. Oh, you need this, you need this, you need this, from up there. And all I'm having is a voice up here in my head, that's just telling me all the things that are wrong with my mouth. Okay, does that make sense? It's not necessarily bad. Those are things they need to hear, but don't tell them to them from over there, because that doesn't create a good relationship, and that doesn't create trust. What that tells me is like, well, if it's like that, why can't you sit in front of me for a moment, and have just a simple conversation? Having an actual face-to-face conversation with your patient is so important. And we're going to talk in a minute about specifically how you get, a treatment plan, or how you can deliver a treatment plan that influences them, that gets them actually to stick with your practice for the lifetime, because that's what you want. You don't want, forgive me if I put words in your mouth, but please tell me if I'm correct. Ideally, patients wouldn't just come to your practice and have the one treatment for the one tooth that was hurting right then, and then they go away and you never see them again. Ideally, what would happen is that a patient comes to your practice, they get an exam, they enjoy their visit, somewhat to some extent. You tell them what they need, and they say, okay, let's do it in sort of this time frame. And then they come a few times, and you build and strengthen that relationship as you go along, so that maybe 3 months down the road, they will call and they'll be like, hey, my kids are ready for a cleaning. My husband is ready for some work. My friend needs a crown. And the referrals start coming because you have taken the time to actually have a face-to-face conversation and build some rapport with your patients. So your body language is super important. And I tell you this from like personal experience of being a patient, and from personal experience of being in front of hundreds and hundreds and hundreds of treatment presentations by many different dentists and dental professionals. And I can tell you what works. And what works is sitting and being like face to face. We're a team. let's work on this together. Here are the couple of things that are important for you to know. The patient is there because of your authority. The patient understands that they don't know some things that you know. That's why they're there. They're there because you're the clinician. So as a clinician, if you sit in front of them and relax with them and you become a little bit of a counselor, then your patient will definitely get glued to you, because that's just something that doesn't happen that well at most dental practices. Most dental practices do it kind of like this doctor. The doctor became a doctor because he didn't like to talk to that person so much. He became a dentist because he can be with his mask and just do his work. The person's got their mouth full the entire time, and hey, I don't have to have much of a conversation, which is great. If you're that kind of introvert, get over it a little bit. I say that with a smile, like really get over it and learn to build a little bit of rapport with your patients, even if you don't enjoy so much social interaction. Learn a few tips, a few tricks that would actually get you there. So another thing I want to talk about when we think about rapport is your intent is important, right? Knowing that you have your patient's best interest at heart, that you're not just selling them something that they don't need, but that you're co-creating a plan with them that is in their best interest, right? So additional tools, additional things that you can pay attention to are, for example, your voice. How you utilize your voice is also extremely important, and is something that your patients can basically or will help you build rapport with your patients in this way. Pacing and leading is how you create a rapport quickly. Yeah, so you meet the person where they are, that's pacing, and then you lead them somewhere else. So if a person comes to you and they're a really slow talker or something like that, and you are a really fast talker, that's a very big mismatch, and that's really hard for the slow person to really get in the conversation with the fast person, and for the fast person to get in a conversation with the slow person. It's really hard. Would you agree? Maybe you've had something like this happen when you're like, come on already, would you speak a little faster, please? Right? And maybe you've had the conversation where it's like, whoa, can you slow down a little bit? I can't really understand what you're saying. That is one of the ways in which we can actually get rapport, is actually matching what the person likes, right? Because if you think about it, if a person comes to you and speaks really fast and you speak really slow and then they tune out, they don't hear the information that was important to them, then nobody wins, right? But if you match what they are bringing to you and you speak a little faster, even if you are a slow talker, the most flexible system wins. The most flexible person in this couple, right? If we're talking about two people, you as a practitioner and your patient as a patient, if you're talking about those two people having a conversation, the most flexible person is going to win. This is why children are so good. Children have unlimited flexibility. You tell something to a child and they go, but why? And you give them a reason, and then they go, but why? And then you give them another reason and they go, but why? And you at some point in time run out of things to say. It's like, well, because I said so, like that's because that's the way it is, and the child has continued to be like, well, but why? I mean, there has to be other reason. This has to continue to evolve. The most flexible system is always the one that is going to win. So if you think about this idea of pacing and leading, meeting the person where they are, and then taking them somewhere else, that would be like me saying to you, for example, I know that you are, as you are sitting there listening to me, watching this presentation, you might begin to think of ways in which you can use these simple language skills with your patients. So let me back up for a minute. What I did there is I gave you a couple of simple, what we call pacing statements, which just talk about things that are observable, that are true, that you basically can't deny. I'm willing to bet that you are sitting, or you might be standing, some of you may be laying down, but most of you are most likely sitting down. So as I said, as you sit there, what happens inside of your mind is you're going, Yeah, okay, I'm sitting here. It's a very subtle change in your mind, but it is important. So I said, as you sit there and you're listening to me, which is, if you're sitting there and we're having this conversation, then you are listening to me, right? So as you sit there and you're listening to me, you might begin to think of ways in which you can use these simple language skills with your patients. Yeah, so what I did is two simple pacing statements as you sit there listening to me. That way you're kind of going, yes, yes. I don't know if maybe you notice yourself saying, doing that or saying that, maybe not. But I'm telling you, that's kind of what happens in the mind. The mind goes, yes, I'm sitting here. Yes, I'm listening to you. And then it's easier to deliver the suggestion that I delivered, which is you might find ways to use these skills with your patients, right? That's a simple command, a simple suggestion that I'm giving you in order to do that. So how can you use this with your patients? Think about ways in which you can build rapport in the same way with the patient that's sitting in the chair. As you sit there, Mr. Patient, comfortable in that chair, because nobody can deny that the dentist chair is kind of comfortable, the way that you're leaning back. You might start to consider the few options that we're going to talk about in a minute to get your oral health where you need it to be. And all we're doing right now is create a couple of simple pacing statements that are now opening the patient's mind to the treatment plan that is going to be delivered later. Does that make sense? So this is actually pretty important, and you can use many different sort of areas of pacing and leading. One of the most important being the voice, because voice has a lot of different qualities. So if you learn to utilize your voice qualities and you learn to listen to what the patient is bringing you and what their voice qualities are, you can understand. If they're a loud person, then you can be a little louder and then bring them down to your level. If they're a fast person, you can be a little faster and then slowly bring them down to your level. But the idea is to match at first so they feel as if you have that affinity. They understand that you are sort of more understanding of them because you are demonstrating, you're demonstrating an understanding of what they are. So anyway, let's move on right here a little bit. I think I have. Yeah. So the next thing is, how do we influence our patients? The first step to really influencing your patients is to listen intently. Yeah. If you ask your patients where they work or what they do, only for the purpose of being able to, dig in the wound, like I said, then you're not really listening. You just listened, you just heard what you needed just so you could harp on them. And that's not the way. However, if you listen to your patients a little bit more intently, you're going to find that really they give you all the information that you could possibly need. One of the things that's also really important about listening is that building rapport and influence is where sort of all the fears lay. Yeah. If you ask your patient, well, how was your last dental visit? And they tell you about certain details about their dental visit, and you go, okay, great. Let's move on. And you move on to your appointment without really thinking about it and going, okay, so this patient has a fear, right? This patient has something that I can influence by building a little bit more rapport, by influencing, by explaining something to maybe a different level, because people need different levels of explanation. Like some of your patients want every single detail about every little thing that you're going to do millimetrically. And some other patients are like, oh, so this is what I need. Okay, let's do it. It's just a different kind of person. So you have to listen to be able to understand what that particular person's fears might be, and then be able to, through enough rapport, fix those fears. Because if the patient is afraid of the shot, for example, they're afraid of the anesthetic, which is very common. I'm afraid of the needle. Okay, if you're afraid of the needle and you're a practitioner that gives a lot of injections, obviously it's not a big deal to you. Like, you're not afraid of the needle. Most likely you're just, to you, it's just a needle. Like, it's just routine. You do it. But to the patient, that's something that's a big deal. So you could, even though you're going to do the same procedure, because there's not a whole lot you can do. Of course, you can shake the cheek, you can do different things to make it a little bit more comfortable. However, it's still a shot. They're still going to get a little bit of a pinch. They're still going to have that sensation, so the fear comes out of not knowing. So if you were to explain this to your patients properly, you listen and you say, hey, Mr. Patient, I know that needles are not your favorite thing. So while I give you this shot and get you nice and comfortable, I'm going to just talk to you a little bit about something else. What's your favorite thing? Vacation. And then you can talk to them about something else that distracts them a little bit from the fact that you're like, in their mouth about to give them a shot. So building rapport and being able to influence your patients is going to help you fix their fears a lot, and when you help somebody deal with their fear, then they will also become that patient that refers their friends and family. That's a good patient. That's a patient that really likes you, because most doctors and most dental teams, like I said, is so routine to you. What you do is so routine that it's more like taking your car to the shop, taking your car and just being like, oh yeah, I need a new carburetor, a new radiator, it needs a new alternator, whatever word we use for cars. It doesn't really matter. What matters is that to you, it's kind of more like that. Like you're more like mechanics about it. Like, yeah, this is what you need, this is what we're going to do, and boom, boom, boom. But to the dental patient, that is something that is much more emotionally attached. Okay, so listening is hugely important in order being able to influencing them. And then the next thing is to be able to empathize, to have them know that, yes, even though you do these all day long, all the time, that to them is something special, to them is something important, to them is something that doesn't happen every day like it does to you. So the patient is going to need to feel that care, to understand that you care. So what I like to think of is ways to quote unquote hug your patients. How can you, as a dental practitioner, give patients a simple virtual hug, like show them how much you care, because how good a comforting hug feels. If you're feeling down and somebody comes and hugs you and says, what, it's going to be fine, things are going to be good. Like, even even if that they're not going to be great, that at least you have somebody there with you. So how can you become a little bit more involved and bring your patient into the decision-making process? I think that's what's super important, is not only obviously empathize with them and think about like what is actually happening to them in their life, how what you're doing to them or with them is going to reflect everywhere else in their life. Does that make sense? So empathizing with them is super important, and ways in which you can do that are by really sharpening your listening skills. You can listen for things that are like keywords. You can listen for their motivation. You can listen for what their actual needs are. So when I talk about keywords, I'm talking about words that are already anchored in their own mind in a positive way. So if a patient comes to you and they're really excited about something, they say, oh, I just came from this amazing vacation and blah, 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 you could know that the word amazing with this sort of feel could be a key word for them, right? That could be, without going too far, that could be like a hug for them. The patient feels like they're being hugged when they just have an amazing experience. So if you notice that they bring that to you, that energy to you, then when you talk about how great their appointment is going to feel, is going to go, and then you can talk about how amazing they're going to look afterwards, how amazing their smile is going to be, and how amazing their recovery is going to be, or whatever that is. Just think about those keywords that you can utilize in order to help you build even more rapport with your patients. And the other thing when we're empathizing with your patients is to think about the motivation. if you understand the patient's motivation, then you can influence them a lot easier. And I don't say that in a way that, you're going to sell them what they don't need. Of course, again, this is all in the patient's best interest. But when you empathize with them and you understand a little bit more of their motivation, so you have your daughter's wedding in a month and you want your smile to be right. Totally, I understand. Okay, well, let's make it work. Like that pulls a lot stronger than just like, oh yeah, I have no rush, I'm just here to get something fixed, right? So if you are able to ask the right questions, but again, your intent has to be right. It can't just be like immediate. If you ask the questions, you are asking those to elicit information, to build your arsenal of information, so that later on, another visit or 3 visits later, you say, hey, by the way, how was your daughter's wedding? And the patient's gonna be like, wow, you remember, that's great. And that is the kind of stuff that builds the rapport. So just try to be more human, I guess is what I'm saying. When it comes to the empathizing with your patients, basically, yeah, just being more human and more in tune with their needs is what's going to get the patients to really feel that you care, to really understand that you care. Now, the last thing on this influence part is to co-create a plan for them. And I want to share with you just a really quick treatment presentation for something, so let's talk about different kinds of treatment presentations. There's a treatment presentation where I am in the chair and I've just had my exam and my doctor is standing right here beside me. Hang on, let me change the camera here so you can see me. I'm laying back, the doctor's standing right here beside me, and the doctor is just saying, well, you need a root canal. And then the doctor goes away. And I'm like sitting there waiting. And then the assistant comes by and, cleans up whatever he's doing. And then the front office manager comes in with a piece of paper and puts it on my lap and goes, well, doctor says you need a root canal. And the patient goes, well, I don't think that's enough. That's not enough co-creation. I'm not involved in that decision. The doctor is just telling me what I need. And I'm not a child. I mean, I don't need the doctor to feel like my parent. I need the doctor to be my counselor. I need the doctor to be a friendly person that knows more than I do about certain things, to tell me about those things. So I like to share with you just really quickly what a doctor that I worked for, his treatment presentation was so clean to me in my experience. Is one of the cleanest ones that I've read or heard or seen. I've seen a bunch of different ones, but this doctor would basically sit down in front of the patient. Okay, so he would sit down to have that conversation face to face and say, well, Mr. Patient, here are some options for you. And this is basically strategizing together with the patient. Yeah, so he would sit down in front of them and said, Mr. Patient, the way I see it, we have basically 3 options today. Option number 1 is do absolutely nothing. Okay, I mean, I know that seems weird coming from a doctor, but I mean, that's always an option. You came here with some pain. You could do nothing. That's option number 1. Option number 2 is the nerve is affected, so you're going to have to drill a little bit more. We're going to have to do a root canal in order to stabilize the tooth. You're going to be able to keep that tooth in place, and then we're going to have to basically do a crown on it to cover it up and actually have a usable tooth again in place. I'm not using all the specific language because I'm not a doctor. I've seen understand the idea of what I'm trying to do rather than the specific language. Okay, because I'm not a dentist, not clinically trained. So there's my disclaimer. The first option is do nothing. The second option is, well, you need a root canal because the nerve is affected, and this is how it's going to happen, and then you get to keep your tooth. The third option would be to have an extraction, actually pull the tooth out, and then we'll wait for a little bit for the area to regenerate, and then we will put a post in and put an implant on. Actually, there's, I guess, another option. Like during that time, we can also do a bridge. Other things, you give the patient option, then you say, now, Mr. Patient, based on what I'm seeing, in your mouth right now, if it were my tooth, I would do this. Yeah. So you open up with a few options that are doable although only one of the options is really good, because you know as a clinician that most of the time only one of the options is really what should be done. The other options are just less than, right? But there are options. So give the options, give 2 or 3 options or whatever you feel is necessary depending on the treatment that you're giving, that you're trying to do. And then tell the patient, you know, if it were my tooth in this exact situation, this is the one that I would do. This is what I would recommend. Now the patient has understood the options, has felt like you have involved them, and now feels like, well, doctor's saying if it were their tooth, they would do this, like with their own mouth. Like that is something that is easy to trust, right? Easier to trust. So co-create, you know, strategize together with your patients, because that is definitely going to help your treatment presentations go further. Now, we have a few minutes left. Let me tell you about some tools and tricks that I told you I would tell you about. So one of them is the word but, and using it as a but flip. So the but flip means, for example, a patient comes to you and says, well, doctor, I know I need that root canal that you mentioned, but I just can't afford it. Now, if you've heard something like this, it doesn't have to be that, but if you've heard a patient give you an objection like that, go ahead and type yes in the chat just to make sure that we're still having this conversation. So if you've ever heard a patient say, hey, you know I need this, but I just can't afford it, then you can but flip it, which means just basically repeating what they said with the but in the middle. So we're going to do the opposite way. So Mr. Patient, I know that you can't afford it, or that you think you can't afford it, or that finances are difficult. Okay, again, understand it's not the language, is the meaning. It doesn't have to be specifically exactly the same, although it works really well if it's the same. But you could say, listen, Mr. Patient, I know that the finances are really difficult, right? That's kind of the same as saying, I know you can't afford it, but in a nicer way, you know, but you know that you really need this. Think about what happens when we flip that on its head. When somebody says to you, when your husband or wife says to you, oh, honey, I was going to take out the trash, but didn't happen, right? Honey, I was going to wash the dishes, but it didn't happen, right? So whatever comes before the but gets negated by the next phrase. So when the patient says, you know I need it, but I can't afford it, they're negating their need. They're saying it's not going to happen because I can't afford it, right? So what we want to do is basically flip it. Yeah, I understand that finances are difficult, but you know you need that root canal. And then you want to move that conversation a little bit forward by saying, and let's figure out some form number 1, form number 2, form number 3, in which we can actually make this happen, right? Let's figure out some ways in which we can help you make this happen. So that's how you get a basically counteract an objection that they have used on you or with you. Does that make sense? The second thing that I'd love to do is tell you about tag questions. Tag questions are awesome. They are basically giving a statement that then asks a question after the person has already somewhat agreed to something. So let me give you a quick example, or let's do this. If I were able to give you some quick examples that you could, like magic bullets that you could take to your office and use right away, that'd be great, wouldn't it? And if you could take those things to your office and you were to use them on your patients, just take the butt flip that we just talked about and take that in your head, of course. So you just remember to use it. If you were to take that to your practice and just use it with your patients, it's possible that you're going to notice immediate changes, don't you think? So what we're doing is just giving a statement, and I'm doing that as I'm kind of nodding a little bit, you know, hey, you could use this with your patients, couldn't you? I mean, this skill is simple enough to use with your patients, isn't it? So what I'm doing is giving a statement, and then I'm closing it with a question, and I'm doing a little bit of nodding. So if you felt like you were nodding with me and going, yeah, as I was saying those, type yes in the chat, or let's put it this way. Some of you probably felt like you were nodding with me and sort of agreeing, didn't you? And if you did, then that's how target questions work. Does that make sense? They're hard to disagree with, aren't they? Yeah, are they? Yeah. So if they are hard to disagree with, then you can use them to your advantage. Does that make sense? And then the last thing I want to share is one little pattern. It's a word, it's a language pattern that helps you actually move this here. Yeah. That helps you sort of move the conversation forward, redirect the conversation. When, let's say, a patient says, "Oh my gosh, doctor, I just can't afford all the things that you're giving me," which is very common. The pattern goes like this: the issue isn't blank, it's blank. So those blanks are going to be filled with, the first blank is going to be with the objection they gave you. "Mr. Patient, you know what? I get what you're saying, but the issue isn't being able to afford it. The issue is that your oral health is going to suffer, that blah, blah, blah," and whatever reasons you can give them. Yeah. So the first one is what they gave you as an objection. And the second blank is filled with some options, some ideas as to why, some supporting evidence, if you will, some supporting documentation about what they are asking to do. Does that make sense? So, yeah, I just can't afford that. Well, Mr. Patient, the issue is not being able to afford it right away, like right now. The issue is that your health is deteriorating quickly. And if I can maybe show you just a couple of different ways in which we help patients that sometimes can't afford the treatment actually get treated, then we'd love to do that. Is that okay? And then you can get that conversation to move a little bit forward. All right, does that make sense? Now, Dr. Sarah, I think we're getting towards the end here. Let me tell you, if you are interested in learning more about all this stuff, I wrote a book called Hypnodontics, which you can get on Amazon really easily. I could send it to you, but it actually cost me a lot to send it. So you can get it on Amazon for inexpensive if you'd like to learn some more. And if you'd like to work together, maybe take just note of my email address, if you like, and that is juan@hypnodontist.com. And I have two ways in which I work with dentists and dental professionals in all roles of the practice. And one of them is a recorded masterclass that's 30 hours. That's with Dr. Munir Ravalia. That's already ready for you if you want it. And you can just come and learn a lot more of these skills. And the other option is a case study program that I will be starting in April. So what I would love to do is just, if you're interested in any of this stuff, let's just start a conversation. You can send me an email at juan@hypnodontist.com, and you can put on the subject either masterclass, if you might be interested in the recorded program, or you can put on the subject case study if you are interested in maybe joining me in April for some live coaching. The other one's a recorded program, the case study is a live program. So I think that's what I have for you today. Let me see. Let me go back to this camera. Did everybody got to take a note of my email? And please, I think it's time to come back with some questions. Dr. Sarah, are you there?
Yes, I'm here, and I'd like to thank you so much for this informative session. It was really a very nice presentation. I personally learned a lot. Meanwhile, I'll ask your permission to introduce our company to the participants.
Please.
And participants will have time to type their questions in the question and answer box. So this is our organization, DentistChannel.Online, Healthy Smiles, Wealthy Lives. DentistChannel.Online is India's first digital dental media company. We did webinars and courses with more than 400 national and international speakers, many successful world implant expos, more than 700 live dental webinars, 20 online workshops, and much, much more. If you're not a Prime member yet, kindly join our family to get free certificate of participation after every event and get exclusive offers and discounts on our online and on-site paid workshops and courses. Most importantly, Prime members will be awarded with 1 CPD CE point for each free webinar. You can use my code SAR100 to benefit from a discount, so you can get the Prime membership for $9 per year. This is an example of the certificate of participation that you will get after every event. About our upcoming webinars, tomorrow we have a webinar with Dr. Salam Harfoush about the basics of mastering ceramic veneers preparation. On March 27, we have two webinars, one with Dr. Kadu, she will talk about maxillary sinus lift procedures, and another one with Dr. Rhea about oral hygiene in orthodontic patients. About our upcoming master classes, we have one happening tomorrow, Communication, the Key to a Successful Dental Practice with Dr. Jaina. I request all the participants to kindly save this number and then send a message on WhatsApp with their name, so they will be added to our broadcast list and they will receive everything about our upcoming dental webinars and courses. Today's webinar is sponsored by NovaMind. NovaMind offers a full spectrum of implants and prosthetic solutions that accommodate any clinical need in modern implantology. We successfully supply highly demanded dental implants types called internal hex, tissue level, bone level, and active conical connection. Our EU production unit and product quality is appreciated worldwide. If you want to know more about NovaMind, kindly check their website. Last but not least, don't forget to follow us on our social media platforms, Facebook, Instagram, and YouTube. Okay, so that's it. I think we have a question.
Yeah, we have a question that says sometimes the patients can continue to create a conversation and eat away at the appointment time, and how to cut into lengthy conversations without hurting the patient. I think that's all about the relationship that you are building with them. You know, the patient knows that your time is valuable, that you have a job to do. You know, so if the patient is just getting maybe a little bit too lengthy on the conversation, you can say, hey, you know what? I absolutely love more detail about what you're telling me. I'm super interested in your trip to Hawaii and how your family went to the volcano. That sounds really amazing. Tell me about it a little bit later, if you don't mind. Let me just get through here. I need to get in your mouth. So if that's okay, let me just tell me about it later. I think the tell me about it later is probably the better sort of way to get out of it a little bit easier. But you know, it's one of those touchy subjects, because obviously people are different and some of us get offended a little bit easier than others, you know. So I think that's going to be a little bit personal on how you connect with that particular patient, and just understand the idea of pacing and leading. You know, if you just say, if the patient's talking blah, 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 and you just say, oh, I'm going to have to cut you off so we can get the work done, that's really abrupt, you know, and that's going to hurt the relationship a little bit, you know. But if the patient is going on and on and on, and you say, hey, you know what, I can tell that you're super excited about your trip, and you're getting me excited about your trip, so I definitely want to hear the details. However, if you don't mind, let's get the work that we need to get done right here, just so I can keep all the other patients on time, or something along those lines. You know, they will, if you put it that way, if you put it that softly, and you meet them with, oh, I know you're excited, I can tell that you are, you know, you have a lot to say about this, you know, I can tell that this is important to you. So that's a pacing statement. So pacing and leading, again, going back to that technique, that's really what makes sense to me, you know. But the specifics of that are going to be different based on the patient, you know, because some patients are going to need you know, a little bit more caring, a little bit more hand holding than others. You know, some patients are a little bit more offendable than others, if you will. Does that make sense? So I think I answered that question, but does anybody else in the audience have any questions for me before we disconnect? Last chance. All right, here's my information again. So if you'd like to, you know, work together or just connect with me in any way, please do so. Juan@hypnodontist.com is where we can connect, and send me an email that says either masterclass or case study if you're interested in working together. Of course, you don't have to do that. You can just have a conversation with me. But if you're interested in the courses, then that way I'll be able to find your email easily and send you some information. So thank you so much, everyone, for being here. I really appreciate your time. You know, I hope that you've gotten some valuable information out of this, and some tools that you can use and reuse and teach your teams as well. And thank you, Dentist Channel Online, for having me.
We would like to thank you for sharing your knowledge and experience with us. It was a pleasure having you on our platform. We are looking
Thank you so
forward
much.
to organizing more webinars with you in the future.
Yeah, looking forward to the next one. You guys have a great evening, and I will see you next time.
Thank you. Have a nice day.
Thank
Bye.
you. Thank you as well. Have a good one, everyone. Disconnecting. Bye-bye.